This is the brief on optimizing blood thinner duration for high-risk heart patients. Now, after getting a heart stent, patients are given DAPT, basically an intense regimen of blood thinners to prevent clots. But for patients with a high bleeding risk, the standard 6 to 12-month therapy is a total medical tightrope walk. We have to keep the blood thin enough to avoid a clot in the new stent, but thick enough to prevent a life-threatening bleed. Well, a massive new meta-analysis of 14 trials and over 11,000 patients finally tells us if we can safely shorten this tightrope walk. First, cutting the DAPT duration down to an abbreviated 1 to 3 months significantly lowers the risk of major bleeding compared to the standard 6 to 12 months. Okay, so we save them from severe bleeding, but doesn't stopping the medication early leave their heart completely unprotected? Second, shortening the therapy did not increase the risk of major adverse cardiovascular events, meaning heart attacks, strokes, or death. It feels counterintuitive. It's kind of like finding out you can take your winter coat off in February and still not catch a cold, but the data proves the heart stays safe. Finally, looking at the nuance between these timelines, a 3-month regimen is definitively safe, whereas the 1-month ratio showed a slight, though statistically inconclusive, bump in cardiovascular risks. So is 1 month just cutting it a little too close for comfort? For now, 3 months seems to be the ultimate sweet spot. To sum it up, for high bleeding risk patients, scaling back blood thinners to a 3-month regimen after getting a stent drastically lowers bleeding danger without sacrificing any cardiovascular protection. Sometimes less medication doesn't just mean fewer side effects, it means better medicine.